The following program is being brought to you on the Voice America Health and Wellness channel. For more information about our network and to check out additional show hosts and topics of interest, please visit voiceamericahealth.com. The Voice America Talk Radio Network is the worldwide leader in live Internet talk radio. Visit voiceamerica.com. The views and ideas expressed on the following program are strictly those of the hosts or guests and do not necessarily reflect the views and ideas held by the Voice America Talk Radio Network, its staff, and management.
Welcome to Falling Through the Cracks. Feel alive and thrive with Dr. Rebecca Risk. Do you ever feel that even though nothing seems seriously wrong and you pass all the medical tests, that you still feel that your health, pain, and fatigue are completely out of control? It doesn't have to be that way. Listen to the tips and suggestions given on our program today and take back control of your health. Now, here is Dr. Rebecca Risk.
Hi, everybody. Welcome to Falling Through the Cracks. I'm your host, Dr. Rebecca Risk. Today, we're going to be talking about something that does affect a lot of people in this day and age, which is fertility and hormones. We're speaking with Dr. Ashley Abbs, who is a registered acupuncturist with the College and Association of Acupuncturists of Alberta in Canada. She's also the owner of Terasana Health, a women's fertility, pregnancy, and postpartum health center. Born out of her professional experience helping hundreds of women get pregnant in her own fertility story, she created the Living Fertile Method, a program and way of life for women to embrace their bodies and empower their lives while achieving a successful pregnancy. Dr. Abbs is a graduate of the University of Calgary with a bachelor's degree in psychology and graduated from the Alberta College of Acupuncture and Traditional Chinese Medicine as a Doctor of Acupuncture and Diploma in Traditional Chinese Medicine. She is also a fellow of the American Board of Oriental Reproductive Medicine. So, Dr. Abbs, welcome to the show.
Thanks. I'm glad to be here.
So I guess one of the first things to start with is what drew you to treat fertility in the first place?
Okay. Good question. So I kind of fell in love with treating fertility while we were in school. We talked about gynecology and treating women's bodies and hormones in a way that I had never heard before, and to a point where I was like, oh, you can actually treat that. You can actually help people that maybe haven't been able to achieve a pregnancy through the regular good old-fashioned way of conception, and even in trying artificial reproductive technologies like IUI or IVF. Maybe they've failed or weren't perfect candidates. And Chinese medicine provided an opportunity to kind of look a little deeper and solve some of those little problems within a woman's cycle in a way that I've never seen. So I just kind of fell in love with it in that way. And then in my own health, while practicing, actually seeing some recurring issues happen along my clients and doing some further investigation in my own health in realizing that, oh, hey, I might have an issue. I might have a problem actually with miscarriage. And so working on my own health through diet, lifestyle, and different self-care techniques to be able to achieve a full-time pregnancy and now have my son, and he's 3. So, it works.
I think a lot of us go through journeys with our patients as we learn more. The longer we're practicing, more stuff comes along, whether it's new or old information or was there or harder to find. I think it's part of that learning and being a good practitioner as well as to learn along the way.
Yeah.
So one of the things, of course, is being a doctor of Chinese medicine. I would guess that you treat hormones differently than conventional, which is with hormone replacement therapy, especially using synthetic or even bioidentical hormones. What is your take on the hormone replacement therapy?
Partly hormone replacement therapy is not a scope of my practice, so I'm actually not able to do it. And so I've had to find different ways in which to have impact on hormones outside of just take a pill. And now I'm going to say, sometimes it's needed. If you're going through an IVF, you're going to need to take some drugs. But through a natural cycle, if you're looking to just kind of Band-Aid particular places where you think that you might have an issue, say low progesterone or high FSH, a synthetic hormone isn't necessarily going to be the answer because it's really just a Band-Aid. We're not looking at the whole body and why maybe your body is manifesting that type of symptom. So I tend to look at it from a more, say, quote-unquote, holistic approach, and we look at your constitution, your stress levels, what you do for self-care, how you're eating, how you're exercising, and potentially what supplements and or herbal medicines that we might require to offer a little bit of a to kind of hold things while we can figure out the rest of your quote-unquote your life, so that that your life can support you beyond just taking hormones for the next however long until either you achieve a pregnancy or into menopause and your greater life. I don't think it really matters if you're trying to have a baby or you're just trying to cope with menopause. Not necessarily having a synthetic hormone is going to be the answer for everybody.
Well, it's interesting when talking about this because I was given hormones at one point when I was really sick, and not knowing at the time that my liver can't actually metabolize hormones, whatever form they're in, it actually made me sicker. So there has to be other options for people, whether it's by choice or by need. Just replacing the hormones seems to me sometimes like you said, a Band-Aid. And sometimes it's important just to get the body to be able to do that on its own. We have that capability, and we do lose that sometimes just with how unwell we are and how stressed we are and whatever else is going on.
Yeah, I mean, I tend to look at a hormone, say, if somebody comes in with low progesterone, let's say. I look, okay, fine, you have low progesterone, which, I mean, is slightly controversial, but okay. Why? Why do you have low progesterone? It's not just, okay, well, let's just give you progesterone. It's like, well, why is your body not producing enough? What's happened to the corpus luteum from your follicle that it's not capable of holding your cycle through till when you're expected to get your period or potentially have a positive pregnancy test? It's more than just what's happening in that one essential moment. There's, if you take a look at a cycle, it's actually, you could trace it back to 3 months prior. What happened in your life 3 months ago that is now attributed and having an impact on this particular cycle. So it's more than just a singular moment. It really does require a look at everything, because all of that will have an impact, whether you had a cold or you had too much fun one weekend or you were on vacation. I mean, all of those kind of things will impact that particular lab result. And so you really do have to not just go, well, this is what I have. It's like, okay, well, maybe not. Maybe that was just one instance in time.
That temporary time that just needs some support or a little bit of resolution somewhere so your body can do it on its own.
Absolutely.
So one of the things that you do focus on is 5-element theory. Can you just tell us a little bit about that?
Sure. So 5-element theory is not as well known as the traditional Chinese medicine that most acupuncturists practice in North America, and the 5-element theory actually predates the spiritual revolution, and what it encompasses is, whereas Chinese medicine is a little bit more of the XYZ herbal, you have these symptoms, we can create a pattern diagnosis and give you herbs. The 5 elements actually bring in a little bit more of the lifestyle and the holistic, spiritual and psychology of the medicine. And personally, that's what I enjoy doing, because my first degree was in psychology, and that's where I thought I was going. So it's kind of probably why I was drawn to the 5 elements. So essentially, what they do is each element is kind of defined as having a set of associations. So kind of within the yin-yang theory, your organ, a particular organ, particular color, sound, smell, among other characteristics. And they allow you to have a little bit more of a well-rounded look at everything that's happening in your health and your natural tendencies, and also possibly in the way that you think or connect in relationship to other people, within yourself, and with what you want, because it can have abilities to kind of have a little look into what might be your motivations, whether extrinsically or intrinsically, for yourself. And they can, we want to have them become whole so that we have an embodied, I'm losing my words today, but and basically an embodiment of all of the 5 elements within ourselves, but we tend to have a prevalent constitution with one or maybe a second or third element that drive us in our relationship. So yeah,
So how does somebody figure out what element is theirs? I mean, we should just talk about, I guess, what each of the elements are, and then one thing people always talk about, and this is what you like to do, is to talk about somebody is this element, so they have to focus on a certain thing. So what does that mean when we're talking about that?
Sure. So there's 5 elements naturally because of the name. So there's earth, metal, water, wood, and fire. And predominantly one person will find themselves within more or less one element, with maybe a little bit of others in there as well. And so take me an example. I'm an earth element. So earth elements tend to be kind of your natural nurturers, your mothers. They're the peacekeepers. They're loyal. They tend to have a hard time saying no, and boundaries are a hard place for, say, an earth element, whereas you take a metal element, well, boundaries are not a problem. They like the structure, they like order, they're detail-orientated, and they have an ability to be, organized, and where that might come off is when they get a little bit too rigid. When they come out of disharmony with that. A water type is either your philosophers. They can be a little bit more aloof. They're drawn to the depths, and they want to talk deep and have those deep conversations, and they're more about the thinking than the doing for the most part, whereas then you take your wood elements, and they're your natural leaders. Like, they're your mover and shakers. They're the ones that have the vision, and they're going to go for it. There's really nothing that's going to hold them back. And then you have your fire, and they're the lovers. They're the ones that bring community together. They're the ones that are open, and they're ready for any opportunity. And passion and desire really drives them to what they are doing. If they don't have that, if there's a lack of that, then they don't really necessarily see the point. And so that's kind of, it's a really, really brief synopsis. It gets into way more stuff, but the reality is there are ways that you can figure that out. There's actually on my site alone, there's a quiz you can do, so you can figure out your element and then receive a full report onto what that means, and then how you can actually use it as a healing habit to guide you in your life. But there's other ones as well, but mine's pretty good.
I think that's a pretty good basic of the 5 elements. People study this for years, so I'm sure we could talk for hours about it. We are going to take a short break. We're talking with Dr. Ashley Abbs today about hormones, fertility, and the 5 elements. If you have any questions about today's show, please call us, or you can send us an email at anantacalgary@gmail.com, or send us a message on Facebook or Twitter, and we'd be happy to hear from you. We'll be back shortly after this break.
Your favorite Voice America Talk Radio Network shows and hosts are in your car, outdoors, and wherever you need them to be. Listen anywhere. Get our mobile app for iPhone, BlackBerry, or Android at the Apple iTunes App Store, BlackBerry App World, or Android Market.
Much of the time, the illnesses that people feel are simply symptoms, and they mask the root cause of what the real health problem is. You can take back control of your own health, starting with Billionaire Healthcare. This program is hosted by Ashley Black and Dari Samia. Our program will introduce you to fascia, which is the knowledge of the living matrix. This bit of knowledge can bring you the health secrets that only the rich and famous have known. Until now. Listen Mondays at 10 a.m. Eastern, 7 a.m. Pacific on Voice America Health and Wellness.
What causes us to be sick? We're not talking about the actual illness or the scientific cause of illnesses. We're talking about your body and health. Listen for the healing whisper of return to peace. Each week, host Dr. Marianne Chase shows you how to listen to your heart to identify poor health, stress, and disease. You'll learn how to heal energetically and spiritually as well as physically. It's time to depend less on the drugs and more on the heart. The Healing Whisper airs live every Friday at 11 a.m. Eastern Time, 8 a.m. Pacific on Voice America Health and Wellness.
Follow us on Twitter at VoiceAmericaTRN. Get the lowdown on guests, new shows, and your favorites. That's VoiceAmericaTRN.
You are listening to Falling Through the Cracks with your host, Dr. Rebecca Risk. To reach the program today, please call in to 1-866-472-5792. Again, that's 1-866-472-5792. You may also send an email directly to Dr. Risk. The email address is anantacalgary@gmail.com. Now, back to Falling Through the Cracks. Feel alive and thrive.
Hi, everybody. Welcome back to Falling Through the Cracks. I'm your host, Dr. Rebecca Risk, and I'm sitting here today with Dr. Ashley Abbs, who's a registered acupuncturist and doctor of Chinese medicine. We're talking today about hormones, fertility, and the 5 elements and how this can affect you. So, Dr. Abbs, we talked before the break about what all the 5 elements are, and, we all kind of have an element that stands out for us. But how do you use this to help someone find their balance that they're looking for?
Sure. So basically, when somebody comes into my office, I try to assess what their element might be. And sometimes it's a bit of a scavenger hunt in trying to figure it out, but for the most part, we can get a good idea of what might be driving them as a dominant constitution, and that allows me to direct their treatment plan, because we need to create the language that'll allow them to hear what I need to say. So it's not necessarily that my tools and techniques are different per person, but a lot of times it's in the language, because we need to find what's going to help them utilize it. So there's a reason why some people can take some information and just run with it, and other people can, other constitutions might kind of get stuck in self-sabotage. And so it allows me to kind of know, okay, this is where we might get stuck. Say with an earth person, they might get stuck with the food stuff. So we need to create a bit of a plan and a little bit more in a way that creates some nourishment in a way that's going to be supportive for them. Whereas, say, a metal or a wood person, they're just going to go, okay, that's how I have to eat. Done. Go change my pantry, and I'm off and running. So, for another person, they might struggle with some meditation or other kind of self-care. And so, again, it's just changing the language and putting it in a context that helps them connect to it in a way that is going to support them. So it allows everything to be not necessarily a one-size-fits-all, even though some of the tools that I use are really not that different for any person.
Okay. So, I think that's how really we all have to do to work with people, is to understand how to communicate to them in a certain way. And, of course, then some of the tools are the same, but, of course, some will be a little bit different for that person,
Absolutely.
Right? So, for hormone imbalances and this is this, but sometimes it would work on moving it in the same way or balancing it the same way or in a different way, depending on what's going on for each person.
Exactly. There are particular...
One of the big things, of course, is, we're talking about hormones and we're talking about all of this, but what exactly is infertility? What does that mean when somebody comes and says, I'm infertile or I'm having problems?
Infertility, from like a textbook case, is anybody that's been having unprotected sex for over a year and has not achieved a successful pregnancy. So couples, so basically couples can seek referrals to their reproductive endocrinologist. At that point, depending upon their age, women that are over the age of 37, 38 can actually seek that referral a lot quicker at about the 6-month mark, and that's partly just because their hormone levels are potentially declining, and their chances for success have a smaller percentage, so they're able to seek that care a lot sooner. But I mean, that's pretty much the standard. I don't necessarily have to wait for people to be trying for a year. I see a lot of people that are just kind of in the process of trying to figure it out and wanting it to go well. So from an acupuncture perspective, you don't have to wait. You could even start before you're even quote-unquote ready to try. But that would be infertility.
Okay. So when people come to you, are there certain hormone imbalances that you would see more than others, or there's something that's generally going on for people?
I mean, for a lot of people, there actually isn't a hormone imbalance. They think that there might be, and a lot of times it's actually just confirmation and finding trust in their body again. When you've been trying for so long and you thought that you would get pregnant right away, or you kind of in your mind had a timeline of 3 months, and then 3 months has passed, and then in 6 months you start to lose trust in your body. And so it's not necessarily even a hormone imbalance. It's more just finding that connection back to your body and potentially maybe evening out a few little nuances that are happening within the cycle. So like your PMS, or that you really have some pain with your periods, or a few other little health things like being cold. We might look at your thyroid. Some people do have endometriosis. Some other people have PCOS. And so sometimes it's about identifying those so that those can be treated appropriately. And other times it's really just finding better right relationship within their cycle and kind of their body, heart, mind.
Okay, so there are times where people don't have hormone imbalances, like you said, that they're just, they're stressed because it hasn't happened. Does that happen a lot, where it's just not happening, but there's no blood work to follow that up?
Yeah, I mean, unexplained infertility is probably the highest diagnosis that there is infertility, and a lot of times it's partly just it hasn't gone to plan. There's either there's no diagnosis that can actually show what's happening, what's wrong, and a lot of times there's actually nothing wrong, which can sometimes be a really frustrating diagnosis, because at least if you knew what was wrong, you could maybe fix it. Whereas couples that haven't explained, they just kind of are swimming in this it's supposed to be able to happen, but yet it's not, and that really is then where I use the elements a lot in finding the appropriate self-care for them, because there is something happening in their life, whether they may know what it is, certain stresses at work or within their relationship, or just with themselves, but we need to figure that out to find the best way in order for them to cope, and then hopefully eventually do get pregnant. I've had lots of couples eventually with unexplained fertility get pregnant, and then other times there's blood work or ultrasounds that support a diagnosis that there is a legitimate hormone imbalance happening.
Okay. So when you get the unexplained fertility, is this where the 5-element theories come in handy for you?
Absolutely. Yeah. I mean, like I said, that's when we start looking at their constitution and what drives them. It might mean that they need to change their job. It might mean that they need to create more time in order for them to do the yoga and do the, whatever it is that helps them cope, because a lot of times we're just running around too busy, and then we just need to start looking at priorities.
I think we're all really bad at that. Where our priorities are. It's really hard to learn that it's okay to take an hour every day to not do anything, which is I think most women struggle with, as well as most people.
Yeah.
So I think we should explain also what these hormone imbalances can look like. So what is PMS or premenstrual syndrome? What does that look like for people?
So PMS, for the majority of women, would look like they get a little bit more irritable before their period, and then maybe their husbands are the ones that notice that more than they do, or slightly weepy. So there is an emotional component to that leading up to the period. So for some women, when it's extreme, it can happen right after ovulation, and it can last a full 2 weeks. Most women, it starts about 7 days in before their period, which is kind of at the peak of the progesterone, and things start to wind down, so they might get breast tenderness, and just most of the symptoms would kind of indicate a bit of stagnation in the body. And that's how I would view it. So in Chinese medicine, we would look at it as a liver qi stagnation. Majority, and it's not a blanket statement, but majority of the time it's a liver qi stagnation. And 5-element wise, that would be a wood element. And so a lot of times there's unfulfilled desires, particularly with women that are trying to get pregnant. So it's a really high stress time in their 2-week wait, wondering if they're pregnant, are they not pregnant. They're kind of on that balance of hope and despair. And so it's really about finding a balance in order for them to be able to hold that.
Yeah, I can imagine that. I think it's very common to have PMS in our day and age, with our livers being so stressed and then not regulating our hormones properly. And like you said, that extra stress, whether it's waiting for the pregnancy test or just normal life, I think we all kind of tend in this direction. It's more common than not, I see. Mm-hmm. So you did mention endometriosis is something that you commonly see as an issue. Can you talk about that a little bit?
Sure. So endo is a true diagnosis can't actually come without usually a laparoscopy is supposed to be done. So some reproductive endocrinologists will or will not do that, just depending on the severity that they think that it is. But it can't truly be diagnosed without that. But what most women usually have is really, really painful periods, painful during intercourse, really heavy periods. They can bleed potentially the whole month or spot. And I mean, it just kind of depends. Some women without any symptoms can have a really terrible case of endometriosis, and other women have like a very severe, low instances of it, but have like crazy symptoms. So it's a really large variance of what women would experience with endo, but the most common would be heavy periods and really painful periods. And then there are, depending on the severity, implications beyond that to somebody's fertility. Is dependent on if the overgrowth is affecting in their ovaries and has compromised them and potentially their tubes. So yeah, but we would treat that with, say, blood stasis and getting the body to move. Again, stagnation that we need to move and metabolize, and there also is an autoimmune connection in that too. So we would be looking at ways to heal that through autoimmune and self-care.
Okay, and so one of the other things you mentioned was polycystic ovarian syndrome. What does that look like?
So PCOS is usually diagnosed through missed periods. It's very common for women to experience not the average, say, 28-day cycle. They may have long periods stretching from the fact that they may only have a couple periods a year as opposed to one a month. Again, everybody's different, so that would be one of the main indicators in that. There's multiple phenotypes of PCOS, but the most common that you would see is someone that's maybe struggling to lose weight. They may have an excess of androgens, hair growth. They have a fair amount of hair growth maybe on their face and on their stomach. And through diagnosis, their ultrasound may indicate what we would call a string of pearls, which is basically all those follicles that haven't been ovulated are starting to build up in the ovaries, and so their ovaries can be quite swollen, full of mature eggs that just haven't been able to be released, which is why they're not getting a regular period.
Okay. These all sound like very complicated, and it's fertility and just anything really in our bodies are generally very complicated, and I would guess take a lot of time to bring back into balance. We're going to talk about that more after our break. We're speaking today with Dr. Ashley Abbs, who's a registered acupuncturist and doctor of Chinese medicine. She specializes in fertility, hormones, and the 5-element theory. If you have any questions about today's show, please call in, send us an email, or message us on Facebook or Twitter, and we'd love to hear from you.
Follow us on Twitter at VoiceAmericaTRN. Get the lowdown on guests, new shows, and your favorites. That's VoiceAmericaTRN.
If the financial markets interest you, if you want to potentially earn a higher return, if you're not satisfied with your investment returns, or if you're only making 1% on your investments sitting in the bank, do you see the stock market hitting record highs but feel you have no one to trust? Voice America's own Jordan Kimmel, the host of Magnet Investing for over 7 years, is applying his strategies of magnet investing and is managing individual accounts. Jordan Kimmel has joined InvestView, the Red Bank, New Jersey investment education and asset management firm, and his team can help you. Contact Jordan and the team at InvestView at 732-380-7271 or by email at jkimmel@investview.com. If you would like a complimentary portfolio review or to speak to a representative, call us. Past performance of investments are not indicative of future results. Investing is inherently risky. All recommendations should be researched by the investor. Call InvestView at 732-380-7271. That's 732-380-7271.
We all want to live a healthy, vibrant life. With so many toxins in our world, it becomes an uphill battle. Inflammation is the premise of all disease and comes from 4 sources of toxins. With a proper understanding of toxins as well as proper detoxification and nutrition, disease can be avoided. Tune in to Whole Healthy Living with Sharon Brennan and learn how you can live a clean, whole, and healthy life in a toxic world. Start your journey Fridays at 10 a.m. Eastern Time, 7 a.m. Pacific Time on Voice America Health and Wellness.
Your favorite Voice America Talk Radio Network shows and hosts are in your car, outdoors, and wherever you need them to be. Listen anywhere. Get our mobile app for iPhone, BlackBerry, or Android at the Apple iTunes App Store, BlackBerry App World, or Android Market.
You are listening to Falling Through the Cracks with your host, Dr. Rebecca Risk. To reach the program today, please call in to 1-866-472-5792. Again, that's 1-866-472-5792. You may also send an email directly to Dr. Risk. The email address is anantacalgary@gmail.com. Now, back to Falling Through the Cracks. Feel alive and thrive.
Hi, everybody. Welcome back to Falling Through the Cracks. I'm your host, Dr. Rebecca Risk, and I'm here today with Dr. Ashley Abbs, who's a registered acupuncturist and doctor of Chinese medicine, as well as a fellow of the American Board of Oriental Reproductive Medicine. Dr. Abbs specializes in fertility, hormone imbalances, and 5-element theory. So, Dr. Abbs, we finished the last segment talking about endometriosis and polycystic ovarian syndrome, and I know there's probably some other issues that you see. What are more common issues you see as hormone imbalances with fertility?
So, like what the one that you mentioned, having a high follicle-stimulating hormone, or what is usually commonly known as FSH, is a common one, and we see it. I mean, in all ages, believe it or not. It's most common in women that are what we would consider advanced reproductive age, kind of 39, 40 plus. That are still hoping to achieve a pregnancy. It can be common to see a higher FSH for them, and this would be indicated in a blood test. So normally, and what that means is that the body just is working that much harder to produce a follicle. So they tend to have potentially fewer eggs available to them, and quality could be an issue because the body is slowing down. The body's getting ready for menopause at some point, even though, I mean, this could go on for the next 10 years or greater. But the body is kind of just winding down, and so it just has to work a little bit harder to produce each period and each egg. And the implications of that is that if they were to do an IVF, it's just that they would produce less eggs, which then means that they have less options for transfer. So less of those eggs might get fertilized, less of them might produce a quality embryo for a potential pregnancy. But there are ways that you can improve an FSH from an RE's perspective. That's kind of negotiable, but from what I've seen in my practice and many of my colleagues is that we can have a huge impact on egg quality, and that's where Chinese medicine has its best ability and influence is in improving what we would call Jing of the egg through self-care, diet, good nutraceuticals, and potentially herbs to increase their chances. And a lot of times, some of those women have gone on to not need IVF and be able to get pregnant and have beautiful, healthy babies through natural conception. And so it does provide us with more options than what they might be led to believe.
So with these, I mean, we talked mainly about these three syndromes you see: endometriosis, polycystic ovarian syndrome, and the follicle-stimulating hormone as issues. And with those, because I know you just mentioned transfers, which is a fertility treatment. And are you able to help people avoid that, or sometimes that's still necessary with the balancing that you do?
Absolutely. I mean, it really is a varying degree, and I mean, obviously every woman would like to achieve a pregnancy through what we would call natural conception or the good old-fashioned way, but sometimes it's not possible, and so a large part of my work with women is us just navigating that. So there does come a time, and sometimes it is necessary for IUIs and IVFs to be needed in order for a successful conception and pregnancy to happen. And coming to a place, because it really creates, for a lot of women, is a huge place where they feel uncomfortable because it's just not the way it's supposed to be. And sometimes it is, and so it's about coming into peace and right relationship with that being the way that their baby might be born and might come to them, and when that happens, like, that was the right decision. It's just coming to those decisions feeling like that you're prepared. A lot of women just rush into it, and I mean, it has huge emotional attacks on your brain, on your mind, and on your body with the amount of drugs that a woman has to take. And so we really want to make sure that they're set up for success so that they can get the best possible result with as many follicles as they can that allow them for future tries with, say, a frozen transfer. And that does take a bit of time to prepare them for, and it depends on what they're coming in with. So if it's high FSH or endo or PCOS, and even just unexplained, there are things that we kind of would like to do in order to prepare them for that. And at the same time, sometimes a pregnancy happens before that happens, which is awesome.
Well, it definitely takes the romance out of it if you have to, go through a lab and do all these hormones that, from my experience, don't make people feel so great. And as you said, that emotional tax, I think everybody would like it to be natural, but of course things aren't always that way.
Exactly, and sometimes it's coming to the acceptance of that and having the tools in place to deal with the roller coaster that is. I mean, when a woman is going through an IVF cycle, it's an up and down ride every single day through until they get their test result, whether it's positive or negative, and then a new roller coaster starts with pregnancy. So you just kind of you need to have established ways that you can cope and thrive. Because not just coping, but they need to be able to thrive through that process.
Yeah. Well, coping sounds to me more like you're surviving.
Totally.
And, the whole point of this show is to do a little more than surviving. It's to actually thrive through what you're doing and to find that balance so that it's you're living well as achieving what you want in your health. So you talked a lot about self-care. Mm-hmm. And which I think is probably very important for, especially what you're doing. I mean, it's important for everybody, but with, how much stress can impact the hormones, I'm sure that this is something that you talk about a lot with women. Can you tell us a lot about what that looks like?
Sure. So, excuse me. So basically when I do an intake with a client, we want to establish how well they're taking care of themselves, not just getting from A to B, from work to home, and essentially coping through their day. I want to know how they're supporting themselves in their dream beyond just the XYZs of, say, getting pregnant or dealing with their health. Because we can all say that we do all these great things, like we eat well and we take all these vitamins, but sometimes there's more to it than that. And so often I will ask about any ritual that they have. I think that ritual is incredibly important for any person, particularly women, to be able to have a place in which they have kind of something that supports them. And so whether that's through a morning routine or an evening routine or both, depending on what they can create time for. Sometimes it's about us getting creative with scheduling and time because we think we're busier than we are. And it's really just diverting your priorities to something that you're actually wanting rather than wasting time on Facebook or scrolling your phone and watching TV. And so, we talk about spiritual practice and meditation, and it doesn't necessarily mean that you sit on your floor for an hour oming. It might be that you're taking a walk out in your neighborhood and having gratitude. So gratitude practice is a huge thing that I bring emphasis on with my clients, as well as journaling. A lot for women is about processing, and we need to process what's happening in our head and get it back into our bodies. And so I find that for some women it's dancing. Sometimes it's just movement in general. We need to get moving a little bit more. What else do we do?
I like when you talked about dancing. I think even more than just movement, like walking is one thing, but embracing that creative side of us, which does get kind of ignored. And our society doesn't put an emphasis on arts and creativity. There's not much money for them. There's actually not many jobs for them either, and they're very difficult ones. And it's that I can see help to bring that balance that we need when we've ignored it for so long.
Yes. So a huge part of what I bring attention to with my clients is during that 2-week wait. And in that 2-week wait, it is so important. We do cycle through the earth and the metal elements at that time, which is a place of like true nourishment and creativity. The metal element is about artistry. And so to embrace that, and I mean, it's hard. It can be hard if you think of artistic pursuits in the traditional way, because then you're just going to go, well, I'm not good at that, so I'm not going to do it. But I mean, there's adult coloring books now, and there's just doodle and maybe dance. I mean, you can check out Koya.love. QOYA.love is a beautiful dance that you can do, and there's tons of free videos. And that's something that I facilitate here in Calgary as a Koya class. And all of that to bring, I mean, basically you want to feel fertile. And so creativity is a way that we can feel fertile well beyond just having babies. Women create life. We create opportunity, and essentially we're psychic in the sense of what we can grow. And that comes from the energy of our womb. And so it's really about being able to harness that to its fullest potential. And that's something that especially if you're struggling with fertility, it's like, how can you feel fertile outside of just your body? And then that is just using your body as a tool.
Yeah, I think that's really important. And we've lost that connection in our society. I mean, even our medical system separates those things. So you go to a specialist for your throat, and you go to a specialist for your hormones, and you go to a specialist for, something else. And they don't look at that big picture, which is the same as what we're doing with this, where you have to look at the physical for these people, or for anybody, really, any patient, any person. We look at the physical, but we also have to look at that emotional side and the parts that we don't even understand, or we're not going to get that balance, and those elements aren't going to balance themselves either.
Exactly. And another huge part, I think, is community, especially in fertility, but I think in any health diagnosis, anybody that's struggling, it's in isolation, and it's by yourself, with yourself, all the time. And maybe you have a bit of support within your family or your social circle in that way, but it really is about creating community in a way that you can thrive, not necessarily just always in identifying with whatever health issue that you have, but community can go a long way, and sometimes it's like really bringing in that love and that fire is something that's really helpful in that. So go dance with friends. It's true. People do feel isolated. In the beginning of my career, I thought that I would go in the same direction as you, as fertility, although I did end up going into more chronic diseases, just like you, because of my own health. I got drawn to something. But, the women that I did see were separate. They were waiting to be pregnant, and their life was not what they wanted. So they were very upset with where they were. They weren't buying new clothes because they might have to buy pregnancy clothes soon, or they weren't enjoying their job because they wanted to be at home with a baby that they didn't have. And I can see where, that disconnect was so huge for them that it was probably part of what was getting in their way, although they may have had something else. It's so hard for our bodies to work properly when we have that kind of stress and that disconnect with it, and we don't, we're not present. No. Yeah, it's just so important to not wait. I mean, obviously there's certain things that you might not do. I always compare that to exercise, and when women are wondering about exercise and fertility, and, they want to do all these things, and it's like, you can still be in shape. You can still get in shape. You may not be running a marathon, because that's not quite the right energy we want to put into having a baby, and you might not be striving for a six-pack, because that's going to go away. But you can still be in shape, and you can still move, and you can still have fun. And I think sometimes for women, we get stuck in this idea that we can't have fun until we get what we want. And it's like, why not have fun along the way? And that's really about, let's not choose self-care rituals that are going to be a pain in your ass. That you're going to hate the whole way, and then you're going to drop as soon as you get what you want. It's like, let's develop something that you would actually continue, that once you're pregnant and you have this baby, that you're actually going to continue journaling, or you're going to continue dancing, or you're going to continue meditating. Do something that brings you joy and makes you feel fertile, and allow that to take you into however long you want to do it, the rest of your life.
Yeah, it's important. It's not just about trying to get pregnant and then forgetting all the things that brought you into that place of wellness that enabled your body to make another life, but to continue that through your pregnancy as well as through the rest of your life, so you can still have that wellness. You can be well through your pregnancy. You can be well for your family. I think a lot of women forget that they are the center, and if they're not well, the rest of the family isn't going to have that center, and they're not going to be able to be there for their children and for their spouse and in the way that they want to be. They want to bring up happy children, so they also have to be happy.
Absolutely. I mean, women have actually, we're not given credit for the amount of impact and influence that we have. And largely that's within our own circles of influence, within our families, but it ripples out. And so how we raise our children and how our children see us and the ways that we interact with our communities is immense. And really that's how we change the world, is through that influence and impact. And in order to do that well is to not adopt a martyr or burnout model. It's really about us thriving, because that allows everybody else to thrive. And the reality is that your fertility doesn't necessarily end. Maybe your hormones go into menopause, but your fertility, your actual fertility, does not end, because that is what you put out into the world. And it's really about harnessing that potential. Yes, right now you want a baby and that's your center, and that's where you want to have your impact in this moment, but it will go broader than that. And to really keep that at the forefront of your mind of like where this is going. And this is going to you having a really fulfilling and amazing life well into old age.
I think that this is a great point. This is a good place to end the show as well. Generally, my shows seem to have these themes that it's more about your self-care and you thriving instead of just surviving your life and enjoying it as well. Now, if anybody listening wants to get in touch with you, how can they do that?
Sure. So the easiest way to get in touch with me is through my website. The one that's easiest to remember is my name, so www.ashleyAbbs.com. You can check out my clinic site. There is a link to that if you're wanting to work with me with fertility here in Calgary and area. And I have a ton of social media. Instagram, I'm on Instagram with my name, and those links are on my site, Facebook, Twitter, etc.
Oh, that's great. Thank you so much for joining us today. I love the topic and the message that we had today. So thank you.
Thanks for having me.
So I want to thank everybody for listening today. I hope you had a great Christmas and holiday season, and I hope you're getting ready for the new year. So have fun and celebrate and enjoy your family and friends around you. If you have any questions about this show, we'd love to hear from you. You can email me at anantacalgary@gmail.com, or you can message me on Facebook or Twitter. I'd love to hear your comments or your thoughts. We are recording every Monday at 10 a.m. Pacific time, so please join us. We are so happy that you're here with us, and make today a great day.
Thank you for tuning in to this week's edition of Falling Through the Cracks. Feel alive and thrive. Please join Dr. Rebecca Risk again next Monday at noon Eastern Time and 9 a.m. Pacific Time on the Voice America Health and Wellness channel. We'll talk more next week.
Thanks again for listening to the preceding program, brought to you on the Voice America Health and Wellness channel. For more information about our network and to check out additional show hosts and topics of interest, please visit voiceamericahealth.com. The Voice America Talk Radio Network is the worldwide leader in live Internet talk radio. Visit voiceamerica.com. The views and ideas expressed on the preceding program are strictly those of the host or guests and do not necessarily reflect the views and ideas held by the Voice America Talk Radio Network.